All right, well, welcome to Section 504, Digging Deeper. Again, my name is Jennifer Templeton, and I'm the District 504 Coordinator. I'm also the Coordinator for Special Education in Charter Schools. So I fulfill two roles. So if I feel a little scatterbrained sometimes, it's because I'm trying to juggle some balls here. But I'm really excited about this 504 course and what we can possibly offer in the spring as well. So welcome, and I'm so glad that you could take time out of your evening to come to this PGI course. So what we started with was the formative assessment, and what I'm hearing from some of you is that it was a little tough. Not really sure. You have some ideas, kind of where you're headed, but we're not 100% confident in all of our answers. And hopefully by the end of this course tonight, you will feel very confident. I believe that I've gotten all the updated 504 coordinators listed by principals, and you'll know if you are the 504 coordinator in your building. The reason why it's important that if you know you are the designated person is because 504 coordinator people have rights that other people that write 504s don't have, as far as I see in uploading, okay? So if you have any questions about if you're on or not, you can always email me. Usually if you're getting those emails from me, then you are the 504 coordinator. So let's talk about Section 504 in our overview. Systematically, our 504 has presented some challenges for our district, and therefore that's why they created my position. We have found ourselves with a lot of OCR complaints, and we're going to talk about who OCR is and why that's so important. But we really do need to take a look at our practice. There has never been really any designated process or anybody checking for compliance. There's not been anything that's been consistent across our system. And so that's my goal for this year, is to try and really establish some processes, procedures, so that we're all on the same page when it comes to 504. So the purpose, of course, of a Section 504 is to keep individuals with disabilities free from discrimination. Okay? And any federally funded program that's taking monies needs to be able to provide Section 504. So our enforcement is OCR, or Office of Civil Rights. Unlike the IDEA or special education, where we have a grievance process that kind of is similar to the OCR, a parent can, if they don't agree with things that are happening with our system, can go straight up to Office of Civil Rights and cry discrimination. And we've had several cases of that. So we're trying to minimize our cases down to 0, and it's too late for this year, but we will accomplish it next year. I'm confident, okay? So we do have a procedure that we're gonna talk about, a grievance procedure that we can go through so we can eliminate the OCR complaints. So under Section 504, school districts are required to make their programs and activities available, including non-academic and extracurricular programs and activities. And the reason why that's a link is because we've had some issues with extracurricular programs and activities. So the link here is a Dear Colleague letter that I found. So basically the Office of Civil Rights, when they see lots of cases cropping up across the United States, they set out a Dear Colleague letter to say, hey, districts, guess what? We're seeing a lot of problems here. Fix it. So this Dear Colleague letter goes over issues around extracurricular activities, including base programs. Some people think that before and after school programs are not part of 504, but they are. Outdoor education, all those pieces we have to consider. Those are extracurricular activities, sports, field trips. We have to take into consideration that disability and make sure we're making the right accommodations for it, but we have to make them accessible. When I started this training 6 sessions ago, I had an elementary teacher say to me, we had an outdoor education program in which mom was going to go with student on 504. Mom got sick, couldn't go. We wouldn't let her go on the field trip. We wouldn't let her go to outdoor ed. Are we in trouble? Yeah. Because we've denied her access to that activity, right? So we've got to be careful and think about all those other pieces. And we're going to talk about things that we can put in place for those field trips. When we do those field trips or activities, like they're trying out for a sport, do we have to guarantee they make the team? No, but what do we have to have in place while they're trying out? The accommodations, right? Okay. Field trips, we have to have a plan A, B, C, D. Does that mean the parent can't be the person designated? No, parent can be, and sometimes you really want them to be, but sometimes parents get sick. How about plan B? That person gets sick. We had a case in which they trained A and B and never put it in writing for anybody else, and those people got sick too. And so all the staff that were there were never trained, A. B, they never had the plan or anything in writing. Like, oh my gosh, what am I supposed to do with this kid? So we need to make sure we have A, B, C, and D planning for field trips, but also things in writing. So I just wanted to bring that in. It's a case that you can read at your leisure. I know it's great, bedside reading material. But it's really interesting about the case study, and it helps us do better for our practice. So we need to make sure that we're providing accessibility for students with disabilities, and we have to offer them the FAPE, which is free and appropriate education. That's something we always have to consider, okay? Sorry, I'm going to return to full screen. So our compliance officers for our district are our special ed directors, and I'm going to be overseeing compliance as well. So we are the people that are kind of overseeing this whole 504 process. Our grievance procedure is outlined in our pamphlet. And our pamphlet, there's a link to the pamphlet, but I also wanted to show you where you can get more materials. And I think I've made some emails out, put some emails out to people of where you find all the Section 504 materials, but I wanted to show you. So if you go to your sites and you go to the special education site, and on the left-hand side, there's going to be a link to Section 504. In that link, the first document there is this guide. So if we take a look at the guide, this is not a requirement to give to parents. It's this extra information, which I think is very, very empowering for parents to understand what a 504 is. It does kind of outline our grievance procedure, but it's not the rights. Best practice is probably to give them this and a copy of their rights, although the rights still spell out grievance procedures as well. But I think this is a good summary of what a 504 is. So that's the first link. And then you'll see further down, the 504 FAQs are something that was created by Don Bell last year. The parent rights are right underneath it. The PowerPoint is from years before. And then all of the other working documents are underneath. So I've got a lot of pieces there. And I actually just uploaded the tonight's presentation up there too, because some of my past participants said, hey, I'd like to refer back to that. Can you put the presentation up there? And I'm like, absolutely. No secrets here. I am not the wizard. So I wanted to let you know that we do have a grievance procedure in which parents can go through, file a written complaint with the district, which is my special ed directors, and we try very hard to make reasonable efforts to try and work things through before it gets to the level of OCR. In the event that the complaint cannot be resolved, then parents can render a decision or ask a complaint to OCR. We hate to get to that point. We really do want to try and do everything we can. One of the things you need to understand that is if a complaint goes all the way up to OCR, the district can be liable for, as it says, loss of federal funding or monetary damages. So we need to be really careful about what we're doing. So let's talk about eligibility. How is a student found eligible for a 504? Well, it's based on a physical or a mental impairment that impacts one or more of the major life activities, which we call MLAs, or major bodily functions, which is MBFs. And this impact must substantially limit a major life activity that inhibits access to or participation in the curriculum or activities of the school setting. Okay? So what is a mental impairment? What's a physical impairment? Well, a mental impairment can be considered psychological disorders, including but not limited to anxiety. That seems to be very popular this year. Mood, attention, psychotic, somatization, and adjustment. Okay? Or you go to physical impairments, what are considered physiological disorders, conditions, cosmetic disfigurement. Don't know how much that's happening, but it's covered. Anatomical loss, affecting one or more of the body systems, so that it can either be a physical or a mental. Exclusions are current drug users. And this actually reverts back if you have a student on a 504 and they are starting or currently using drugs or alcohol, but mostly drugs, substance abuse, then they're actually no longer considered a student with a disability. The drug abuse and the use of those drugs overrides the disability piece, which is really interesting.
So even if they were identified prior to drug use with an anxiety disorder, and now they're like using drugs, they no longer...
If they're using illegal drugs, yep. We've got some FAQs that we're going to talk about, especially when it comes to manifestation. Very interesting legal cases on that. Most of the time it comes into play when it's about a manifestation. And we'll talk about that a little bit further, okay? So what are the major life activities? Well, we've got caring for oneself, performing manual tasks, seeing, hearing, sleeping, walking, standing, lifting, eating, breathing, bending, learning, reading, concentrating, thinking, communicating, working. Wow, what an exhaustive list. I look at that and I go, I could probably qualify, right? All right. And then, of course, your major bodily functions, which is basically almost everything in your body that's covered, okay? So those are the MLAs. But remember, it's the substantially limits that is the key. And even though we're like, okay, so give me a black and white, Jennifer, I can't. It's not actually ever defined by Congress. So we can interpret it as, and it shall be returned without regard to mitigating measures. So does anybody have an idea what a mitigating measure could be? Yes?
Like if you can't see, so you wear glasses. Like something that helps,
Right.
that makes it so that you can do it if you have something like a drug, like anxiety medication.
Okay, so let me talk about, you had two good answers. You said glasses. Well, glasses is one of the exclusions because we would all qualify for a 504 with glasses.
Right.
But when you said anxiety and medication for anxiety, or if you have medication for ADHD, that is a mitigating measure, okay? That doesn't mean that we say to the kid, hey, I'd like you to go off your meds for a week so I can really qualify you. You never want a kid to go off their meds, but you can't rule that out and say, oh, you know what? Johnny's doing so well on his meds, he really doesn't need a 504. Because you have to think about that in the absence of it. That's what's called a mitigating measure. And that's interesting for us to do, and that's why I think when they reauthorized it, it really opened up the 504 world quite a bit. Also, to include impairments that are substantially limiting when active. So student is, say for example, student is diagnosed with cancer, but they're in remission. Those issues, that physical impairment or the thing that causes the major bodily function issue is not active when they're in remission. But we can't say, oh, you're in remission, therefore you don't need it. They can still be covered under 504 protection, and if we still need accommodations, we'll put those in place. But we can't rule that out and say, oh, you're just in remission, I'm taking you off. Okay? So you have to think about those pieces when active. So an impairment need not prevent or severely or significantly restrict an MLA to be considered substantially limiting. So the inability to MLA, MBF, when compared to how the average person in general population performs the same MLA. So I was in a 504 meeting, and we were going through the MLA checklist with the counselor, and we said, okay, so how is this impacting? How is this disability impacting? And the mom says, oh, it's impacting his ability to take care of himself. And I was like, so tell me what that means. Oh, I have to prompt him to brush his teeth. I have to prompt him to take a shower. I have to prompt him to get dressed. I have to help him, da, 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 da. And I was like, okay, but he's 12. Let's compare him to the average 12-year-old. How many average 12-year-olds have to be prompted to brush their teeth and remember to shower, especially some boys, not to be mean. But you have to compare to the average kid. Do we have to do a lot of that prompting? Potentially. Michael.
So this is the most common question I get, is that a student comes in and says, I have ADHD, they have a diagnosis and everything, but they're getting straight A's.
Right.
And so, and I've had people at the district say, nope, we still have to give him a 504, and I've had people say, it's a gray area, and I've had people say, nope, if he has A's, you don't give it to him.
So I think it goes back to that question of substantially limits.
Right.
How, if he's getting straight A's is not the only thing we look at. We look at all the other pieces to that. And straight A's doesn't mean that you're defaulted, so nope, you're not qualified, you got a straight A's. Okay, so the gray area comes in your evaluation and all of the observations, all the other pieces that you pull in to say, are we substantially limited to access to or participation in the school setting? And if you can't answer, yes, it's substantially limiting, then no, you can't find the student eligible. Okay, so you have to look at that. The other caveat comes with some kids that we call dual diagnosis, where they're advanced learners, right? Twice exceptional, we hear. You take a look at those kiddos that are super, super, super intelligent. We can't compare them to the average person when we're looking at that. So say a kid's IQ scores in the 110s, 120s, really, really high potential, but is major stressed out and freaks out before tests because they have to be a perfectionist and they have to get it right and they actually get sick to their stomach and it causes all these issues and they're getting B's and C's. To you, Joe Average, B's and C's is okay, but to a student with that potential, it's not. And so then are we saying, is that anxiety that goes along with that level and comparing it to other kids at that level, is it impacting or limiting their access to and participation in class? And in that scenario, it might, because they get so anxious about that. So you have to look at all the factors and compare them out to the average person based on their abilities. Does that make sense?
Yeah.
It's a gray area. I wish I could tell you black or white, and it's not.
If you dig deep enough, you can find it.
You can. And here's the one thing that Jason and I talked about, and we talked about this at our counselor meeting too. We don't die on a diagnosis. What our most important part about 504s or even IEPs or other things is that we are meeting the needs of kids. So by putting them on a 504, is it going to improve and meet his needs? Yes, no, you have to decide. We've got to choose our battles wisely when it comes to that. It's hard to say. I hate to say that, but we really do. But that's why we need data. The more data we have, the more informed we can be about making these decisions and saying, well, the data really doesn't show it. Besides just A's and B's, teachers say he gets things on time. His executive functioning skills are really good for an ADHD kid. He's organized. He never misses assignments. All those pieces play into that eligibility. Does that make sense? So that's a good case. That comes up a lot. Okay, any questions about substantially limits? Yes?
So I guess I'm confused because you gave the example of the boy that didn't brush his teeth. So I'm confused then on the wording, the impairment need not prevent or restrict to be considered significantly limiting.
Right. I was talking about the kid who's already qualified for an IEP, for a 504, and the parent wanted to say that these things were impacting. Like this is what is limiting him to those pieces. And I'm saying compared to an average kid, he wouldn't.
So what impairment would prevent him? I guess I'm confused about the word not then.
Yeah, that is kind of confusing. An impairment need not prevent or severely or significantly restrict an MLA to be considered. So it doesn't have to severely restrict it. It doesn't have to be significantly restricted to a certain extent. If it is impacting them, we have to discuss that. It doesn't have to be to this level, is I guess what that's really saying. Does that make sense? Okay. All right, so the procedure. So when I say the word child find, what pops in your head? Preschool, right? Everybody thinks child find preschool. We love our preschool teams, right? Well, that's what I thought before I got trained. And child find is really our legal obligation to notify, locate, and identify kids with disabilities. That doesn't mean that we're going to go through our hallways and go, ooh, you look like you have a disability, come with me, okay? We're not saying that. We're saying that we do have a legal obligation to identify kids that have disabilities. If you suspect a disability, then you should be doing your due diligence under child find to identify if they have one. RTI, the student goes through RTI, they do interventions, they try all these things, and it's still not working. What are you doing at that point? Aren't you at the point where you're like, I think something's going on. I think we might suspect a disability here. And you know, legally, if you suspect a disability and the kid's not on a 504 or not even in the 504 referral process or special ed referral process, and they do something that leads to an expulsion, that they are still guaranteed manifestation rights because you suspected it and you didn't do anything about it. So we do have a child find obligation to do something about those kids that we suspect and figure out, what's going on here? And so that's what child find is. It's not just our preschool. Preschool is where we do a lot of our child find in our district because we're trying to catch them before they go totally into our system. But that doesn't always happen. So procedural safeguards, we have to provide parents a copy of the rights. And that's the link to the rights handout. So every time that we meet with a parent, we give them the rights. We can send it by PDF, or we can give them a copy. But we have to give them the rights at least once a year. Okay? Any questions about the rights? So the eligibility process. So we've gone through RTI, hopefully. I'm going to go 2 scenarios. Gone through RTI, things aren't working, we suspect something's happening. And it could be a dual prong where we're looking at referral to either 504 or eligibility to special ed, or it could be straight up to a 504. Or a parent comes in and says, I've got an outside diagnosis. 90% of our 504s in our district are outside diagnosis. We are evaluating and doing those pieces about 10% of the time on our own. Most of them are coming with outside. We don't require it, and we would never tell a parent to go get it, because if you did, you can get your checkbook out and pay for that. So the process is, okay, we're going to have a 504 eligibility meeting. Parents get a notice of a meeting 10 days before, just like the IEP process. Hey, we're going to have a meeting. What I'm hearing is that sometimes schools are waiting till that meeting to get the actual paperwork from parents or the diagnosis from parents. And I say we need to change that process. We need to ask parents for, if they're, especially if they're walking in and they have the diagnosis, oh great, can I see that report? Why do you think that would be so important for us to see that report before we get to that meeting?
You need people to look at it.
Right, you need people to look at it. I've been in 5 meetings already, it's November, where this was an initial eligibility and the parent slid over the evaluation to the counselor, and the counselor was like, I don't know what this is, and she doesn't have to. So I don't want you to think I'm saying you have to. I'm just saying you better get somebody who knows about that. If I was sitting in that spot and somebody slid over a vision test to me that I don't know anything about, I'm going to say, can we reconvene this meeting? I really need to go to my vision people and ask what this means and what are the educational implications of this? And how do I draft and look at eligibility? And how do I look at this for building a 504? I would never, and I've seen this, and I know it happens, where they get the report and they see the doctor's recommendations and they write a 504 based on the doctor's recommendations. Okay, the doctor's pretty smart about the physical stuff, but do they know about our educational process? Do they know about our educational setting and what's best for the kid? No, we do. So ask parents for that stuff in advance and then get it to people who know what that means. And I think that practice in itself will help us in many ways. And sometimes that doesn't happen. Sometimes the parents will come in afterward with stuff and you're like, oh, you know what? I really don't know what this is. I really need to can we reschedule this meeting? I need to get more information about it. It's totally fine to stop the meeting at any point so that you get the right information. And don't feel bad about it. You're not going to look incompetent or anything. You're going to look like, I'm really thinking about what I need to do for your kid. So that's what we need to do. We also have to provide parent rights. So when you send that notice, you can send the parent rights with it. If we need to do our own formal evaluation, this is probably going to occur probably less than, I'd say, 2 or 3% of the time, where we actually need to get consent for evaluation. And we ask for consent for evaluation if we're doing formalized testing, a BASC, a Woodcock-Johnson, a cognitive, any of the things that we're going to ask our special ed teams to do for us. If we need formal evaluation, we need to get consent. But I'm saying it's like minuscule of how many times we're going to need to do that. Okay? Most of the time, we can gather up enough data through observations, through checklists, going through record reviews, interviewing people, interviewing the parent, interviewing the kid. We can get a lot of the data that we need through that, through their MAP scores, TCAP, grades. I mean, you name it. We've got a lot of resources at our fingertips, but we never need to go to that extra level. We can get consent. Any questions about that? Michael?
So let's say we suspect they have ADHD.
Okay.
And so we say to the parent, hey, I suspect they might have ADHD.
No, you wouldn't say that.
Right. Theoretically.
Okay.
We suspect there's a
I
disability.
think there's something going on that's getting
Right.
in the way. Right.
Right, but we cannot ask them to go out and get an evaluation.
That's correct.
So what the parent says, okay, I want you to evaluate my child then.
Okay, so in the case where we're suspecting something's going on,
Right.
the most important thing in that first meeting where we suspect something's going on and we don't know what it is, but we get some ideas that this kid probably has ADD, ADHD, I always start with probing questions to the parent. When's the last time you saw his pediatrician? When's the last time, what has the doctor seen? Have we seen some patterns with this? What are the, asking. You're not telling, asking. You're not tricking. You're not tricking, you're probing. You're saying, he's the doctor. You're the parent. You've seen this kid. This is not something new, apparently. I don't know. What does your doctor say about that? I don't know. I haven't gone. Whoa, do you think I should go? That's totally up to you. But if you have questions about it, that's what I would do. There's nothing wrong with us saying that. But we're going to do our end to try and figure this out. So a lot of teams are like, well, what do we do for ADHD? Okay, we don't diagnose anybody, by the way, and we don't ever give them any diagnosis. But there are some resources that the mental health, if you go back up to our special ed website, if you notice, we have lots of resources in our district, right? You suspect autism, you suspect behavior issues, whatever it is that you're suspecting, we have teams that can help you with those and resources. And Colette, on her mental health website or Google site, if you click on her mental health, and she would definitely help you with this, she has a whole slew of supports on the right side of her website. And if you click on the link for ADHD, she actually has a bunch of resources for ADHD, and some of them are informal checklists and guides to help you, like what are patterns that I should look for. We've got the Vanderbilt Toolkit, School Identified, lots of resources that can help you drill down. Am I saying that's now your new responsibility? Guess what? It's your responsibility, Michael. No, you got a whole resource of people in your building that can do that, or you can. But those are the pieces that we can pull in to get more data to say, yeah, this kid's really struggling with this. But we never label from our district a kid ADHD. If they don't come in with a physical diagnosis from a doctor on that, we don't label. What we would say is, the student qualifies due to attention issues, concentration, da 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 da. But we are not going to diagnose kids. Does that make sense? Okay. Question.
We are looking at school identified ADHD under an IEP, and we have an IEP meeting, and they're determined that they qualify for school identified ADHD, but only need accommodations and not necessarily like the services.
So if they qualify under IDEA for an IEP, they have an IEP.
Yeah, that's just so tricky.
It is tricky. And so that's where that fine
that
line is of
accommodation
saying
versus-
school identified ADHD 504, school identified ADHD IEP. It gets really gray there.
Like the school identified like ADHD could show an impact that's impacting their learning.
Absolutely.
But all the needs are accommodations, not necessarily like services from.
Right. So
Right.
that leads to a question I get all the time. What's the difference between an IEP and a 504, right? We hear that all the time. It all has to do with rising to the level of needing special ed services. So you have a student with ADHD and how he's impacted could rise to the level that he needs a special ed teacher or a special ed EA sitting with him, prompting. He needs modified instruction. He needs all those things. That rises to the level of special ed. And he's going to qualify and found eligible under other health impairment as a special ed student. But if it's ADHD and it doesn't rise to that level, but yet, like you're saying, he's got some needs, but we can address those needs and give him equal access and offer the FAPE under the accommodations we provide for him, then that would be appropriate for a 504.
So then would you say like through the school identified ADHD process, like in the 504, would you kind of outline? how
You can
would
outline
do
that. You can outline that evaluation, but you will not
Say.
diagnose
Okay.
the child. Right. Yes.
I have a question about service. I'm an occupational therapist, and I, a few years ago, was told that OTs they can provide service. Like, I'd never heard that. So have you ever heard that, or is there?
I have heard that, and I have to get clarification on the OT, but as far as I know, occupational therapy is a related service under special education. And so, although the law does state in 504 that a student is eligible for accommodations and services, what those services are, they never really clearly defined. So I will drill down that answer for you. I'm not going to answer it wrong. I will tell you that because I want to make sure. So I will clarify that. As far as I know, it depends on the needs of the students and our offer of FAPE and all those other pieces. Wendy.
Two kind of related questions. Number one is, and Michael said it really well. I mean, you know, it's flipped. It flips all over the place,
Yeah.
depending on where we are, I think. Number one, like services is a great example. We've always kind of operated that, like, you can't have a resource. You can't have services of a special ed service provider, but occasionally that's also been said that that's okay.
So here's the thing that I try to delineate for the services piece. If it's a service that's provided to all gen ed kids or accessible by all gen ed kids, then it's appropriate for a 504. For example, you might have a school psychologist that works with reg ed kids in a group setting about at-risk or those behaviors. If that's accessible by reg ed kids, then I think that's appropriate to have that service be provided for that 504 kid. And I've heard some schools have resources that have reg ed and sped kids in that resource class. And therefore, if it's accessible for reg ed, then it should be accessible for 504. Where we get really scary is when you're saying, oh, he rises to this level, and therefore we need this special ed teacher to follow through with this intervention or this piece. That's where it's like, well, if he needs that, then why aren't we looking at special education identification? Yeah.
Yeah, where this comes in a lot for me is with high-functioning autistic kids because they need that social emotional skill building and the mental health piece, but they don't qualify for an IEP. And so, yeah, that was my question, too.
Yeah, I think that you...
I do a group for social skills with high-functioning autistic kids. Can I write a plan saying mental health time?
Do other gen ed kids have access to that group?
They do. I mean, if they need it. If a team identifies
if
that
gen
they
ed
need
kids
it.
have access to the group, then that's something that your building is providing. But you can't just say, well, I'm just doing this service for them, for that piece. So think about the general ed access.
And the other thing I was going to say, and again, this has changed to every so often, is it used to be a fairly common practice that someone was coming off of an
Yes,
IEP and
thank
going right
you.
to a 504.
Thank you so much, Wendy. Yes, 504 is not the off-ramp. It's not like, hey, guess what? We're stepping you down. Soon you'll be gen ed. Okay, it's not a step-down process. Sometimes it's appropriate, sometimes, but it's not best practice to go that route at all. Especially when it's just like, well, why are you staffing the student out if they still have these needs and all these pieces? I mean, it goes back to that and that's the special ed deal. But you're right, it's not an off-ramp, for sure. Okay, question?
Always have to have some kind of like official diagnosis to put somebody on a 504?
No, you do not need official. And that changed because I remember when I was teaching and I remember helping with 504s before, that before we used to have this physical diagnosis or this mental diagnosis from a physician. Yeah, that's no longer the case. Yeah, about 3 years ago, I want to say. Oh, people sure do. I got questions on that the first day of my work this year. Yes. Yeah.
This kind of goes back a little bit, but it has to do with the diagnosis.
Yes.
I heard in the past that we can't delay having a 504 eligibility meeting to wait for an evaluation and a diagnosis of students. So, and you said it's best to get that information right up front, so you have time to review, you have time to consult.
Correct.
So where's, I guess, and maybe there is no hard line, but where would the line be? For
We have
that?
60 days to evaluate.
Okay.
Once you meet with that parent, you say, I'm going to start the evaluation process. That means I'm starting to gather all my data. I'm doing all this stuff. It's 60 days, same as special education. All right. All right, so somebody had a great question, and I forgot to bring this up, so thank you so much for bringing this up to me. And what's your name again? Cassie. Okay, Cassie. Cassie brought this up. When is it appropriate for a kiddo to be on a 504 and an IEP, or a 504 and an ALP? We have quite a few of those, actually. And it has to do with more, I see it more where the disability factor that qualifies them for a 504 doesn't require the special education services, okay? For example, we have a student that has an IEP because of learning difficulties and all these other pieces, and they have lots of intervention, special education services and other things like that. But they also have a rare disorder in which they cannot regulate their body temperature. Okay? So, because the accommodation for this student is a significant cooler AC unit in one room, and the use of ice vests that they use to go from one room to the next, or a service dog, I see service animals, different things like that, where that's not special education, that is the 504 need, okay? So for those cases, it makes sense to have an IEP for the educational pieces, but then the 504 could run for the piece that doesn't require the special ed. It doesn't happen that often, but it does happen.
I had another case where qualified for SLD. They assessed for SIED, but he didn't qualify there, but he had a diagnosis of PTSD. So he had kind of social emotional pieces under the 504 for PTSD, and then his learning accommodations under the SLD for the IEP. And I was like,
I don't know if I would put those two together. I would just assess the needs under the SLD and then give them special ed services from a school psych or so. Yeah, that's a weird combo. All right, let's go through this interim because some people are really on their seat because you don't get any feedback, and I wanted to go through it with you, and I want to see everybody get 100 on this. All right, major life activities include All of them, including attending this training?
Yes. It's working.
All right. Major bodily functions include all of them? Even passing this informative? That's a bodily function? Okay, all of them but the passing this formative assessment. Okay. Okay. Exclusions for mental, physical impairments include. All right, let's talk about impairments that are episodic, intermittent, or in remission. Does that exclude that? No, we said we have to take a look at that. Short-term temporary impairments? Yes. Under how many months? 6. Yes. Attention deficit hyperactivity disorder? Are they excluded? Oh, yeah. Darn it. There goes half our 504s. Dyslexia. Yeah, I wish too, but that is a learning disability. We don't diagnose. Current drug users, they are excluded. Okay? Yeah. How do you determine if they're a current drug user? I knew you were going to ask me that, Michael. I knew you were going to ask me about that. So let me... So I have read cases in which they went to that extreme. I've read cases where they did. But I pulled these down from different sites because I think this is a hot one, especially for high school. In fact, I was sitting with Andy Abner today, and he was asking me all these questions. So I'm like, oh, I'm going to put something together. Okay? And so there's a whole FAQ about, how do we know if it's a current drug user? Obviously, they have it on them. That's pretty good indication that they're probably current drug users. Okay? Parent interviews, other ways. It depends on what level and what hill do you want to die on and how far you want to go with that. So I think that's the other thing. It was an interesting article here, and I thought this was really apropos considering that we're in Colorado. What to do when students with disabilities are prescribed medical marijuana. So there's a whole article on that. I thought it was really fascinating. So again, some light table evening reading for your leisure. Okay, so let's back to, we were on the interim assessment here. So I put that together just for my high school folks. Okay, so we did that question. An accommodation plan, what should it include? Medications, treatments, and devices? What do you think? That's a healthcare plan. Mm-hmm. Is civil, but we might talk about, we might talk about devices. We might talk about those things, right? So if you chose that, I would give you credit for that because we do talk about that. And medications are not something, especially if they're in the preventative piece, we might talk about those pieces, but it's not always about that. Is a civil rights law amendment? It's not a civil, well, it's a civil rights law.
It's not an amendment to the law.
But it's not an amendment. Civil Rights Office of Civil Rights is our enforcement, but it's not an amendment. Is a parent prescription for support. Describes the adaptations, modifications, and services made. Yes, that's it. Okay. So the answer we were really looking for is the last one, but I could see where it could be justifiable on the devices. Okay, and we talked about major bodily functions, physical, mental impairments, grade expectation disorder. I love this. My child's supposed to be getting A's. He needs a 504. He's getting B's.
I didn't even know what that was.
Not mental, psychological disorder, yes. Grade level transition impairment. Now they're in middle school. They're screwing up. They need a 504. Physiological disorders, cosmetic different, yes. So those two, right? How'd we do so far? Better? Trick questions. All right. A substantial limitation is the inability to perform a major life activity or major bodily function when compared to how people in general population perform. True or false? True. True. Right, we're looking at general. Oh, well, then you guys did pretty great. Okay. So let's find out how other districts screwed up. I have cases for you with answer. You're going to be the judge. You're going to read through the case with your group, and you're going to talk about what you think, how the judge found. So you're the judge in these cases. How are you going to find for this issue? Okay, so you guys did pretty good on this. Let's talk about these LRP cases. So I want to just kind of put it out. Was there a case? We don't have to talk about them all, but was your case like, maybe this whole group probably could learn from this. Maybe we should talk about it. Sorry. We can do every case if we have some time, but are there aha moments that said, what's going on? Or what maybe what's your takeaway or what's your lesson that you think our district can learn from this case? Maybe we should do it that way. So you guys want to start? What lesson can we do from this case?
You need to involve legal counsel when writing 504 for peanut allergies.
Okay, so this summary of this case that they had, and I have these cases on the backward plan. So if you wanted to really read each case, I put it in there. Let me get to that so you guys have a visual. No thanks. No, I'm just kidding. I would gladly come to any 504 you asked me to come to, as long as yep, and I'm going. I can't go to all 1,500, but I will go for the one. Oops, that's not the one I wanted. Sorry. But I can come help and support if you need it. And then I've also had people start emailing me their plans and go, hey, can I get second eyes on this? What do you think? How do you think we're doing? And I'm glad to give you feedback on that. I'd love to do that, if that would help. Jennifer will do that. All right, so if you get to the LRP cases, I put it right in the backward plan. So these are the cases. So if you want to read it later and get all the details, you can. So case 1 is amazing to me. I was very blown away. And by the way, if you feel bad that you were stumped, don't feel bad, because I gave these to Robert Ross, our district, and I stumped him on 3 cases. So don't feel bad. Okay, but holy moly, look at this plan for this kid, for this nut allergy. Implement emergency plan, no nuts. For field trips, a letter will hear, EpiPen for this. They went over and above. They had a healthcare plan, and they even notes for emergency plan, and they had all this stuff, and the question was, did they deny him free and appropriate education? And the answer was yes. Because why?
That wasn't specific enough in the training.
Yeah, it wasn't specific enough of how they were preventing the nut allergy. It was so reactive, it wasn't preventative, and it didn't even specify. Parents wanted documentation that you trained all the people about peanut allergies, and you trained the cafeteria workers, and you made sure every blah, 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 and you had everybody. The school couldn't produce a documentation of when they trained everybody. And so this district had to pay monetary damages. Yes?
504 plan, if they also have a healthcare plan, to say refer to healthcare
Absolutely.
plan rather than double listing a bunch, because
Absolutely.
like what we have in the healthcare
Absolutely. Right. Yeah. So that was a cool case. Case number 2, what ahas or lessons can you be learned from? 2 is failure to determine eligibility of teen with anxiety.
It would be, what we got from it is that if the school team suspects that something is going on with a kid and that it's a disability that's preventing him from attending school, that the obligation is that the school needs to do an evaluation. In this case, they said the mom had to, and he couldn't come back to school. And we read 2.
It says district and foreign teens parent, the student could not return to school until parent obtained evaluation. Yikes. Exactly. Can you believe that?
You want to go to school.
Wow. Talk about discrimination and not offering FAPE. Yeah, big no-nos, but actually, that wasn't the biggest OCR complaint, was the fact that they knew he had anxiety and they didn't trigger any of that. Again, back to that child find, I really have to bring it back to it. I don't think we think about that much, especially with teens. Third, RTI efforts. Can RTI efforts justify delay in 504? What was your aha learning moment from that case?
I think it was the extended amount of time that it took. I mean, it seemed like that 2-year period was too long.
Yeah.
So at what point-
They kept going over, and I mean, it started in 2010, and they did this, and they did this, and they did this. They kept doing it, and not getting anywhere, right?
60 days.
Oh, no. I mean, they were doing RTI for 2 years and not getting anywhere with the kid.
Question about that, because I think other districts in the metro area do it for a long period of time.
I think a long period of time is fine as long as you keep changing those up and doing other things and you're finding something eventually that's going to work. But if you get to a point where you're like, that didn't work, oh, well, it must be the kid. That's not okay.
What they talk about in the law is that RTI can never be used to delay an evaluation.
Right.
That if you suspect that you need to do them concurrently, that is your obligation. You should not use and say, we have to go through RTI for 6 weeks and then 12 weeks, and we can't touch the evaluation until after that point.
There's
That's
a
what you
lot of
can't
cases for both special ed and for 504 where teams and districts got in trouble because teams said, parents came and said, I think my kid's struggling. And they're like, okay, guess what? We'll put them through RTI first and then we'll evaluate. And the districts lost every time because RTI cannot delay the evaluation. Once a parent asks for those, or we as teams just think that they're having some problems or have a disability, we need to go to evaluation. We can do RTI concurrently and should, to gather up all that evaluative testing and data that we need, but we can never use it as a delay reason. And that was the one thing I learned from, I mean, yeah, that was 2 years, but the gist is, no, we can't use RTI to delay, if that makes sense.
It's not.
Then we need to gather our data.
So we need to do, I mean, I feel like our district takes the stance of the parent requests it, you're going to do it.
It's actually the law. Parent requests
I thought
it.
we had 10 days as a team to decide whether or not we would accept or no. Okay, I thought that was.
Yeah, if parent requests, we have to.
So if we feel like a student, I have one right now that I feel like struggles and has struggled for many years, and I think they have a disability, and they thought all year last year that he struggled, and the comment that I got was, well, it's just a lack of effort on his part.
It's lazy.
Yes, and,
lazy
and
disability.
he's a won't do, which I
Right.
love. And then I'm like, okay, we really need to push forward with this. He's been
You're
part
right.
of RTI. We need to push forward. We don't have enough data. We don't have any data.
And we need to
back
go
it
get
up.
some.
And I'm like,
We need to evaluate the kid.
Like-
We have an obligation under Child Find to evaluate that kid. What's the harm foul of trying to assess him and find all these gaps and address those things? And so what's the worst that can happen? He's not found eligible. What's the best that can happen? If he's not found eligible, we got more data to go, ooh, this is where he's really struggling and this is where we should really target our put our targeted intervention. I mean, what's the harm?
so can you come talk to our school then?
Resources.
It is
Because
resources, I know, but if
I
you've
think
done
that's
this
what
for
it
so
is.
long and you have suspicions about it, how are we addressing that kid's need?
Yeah,
What
I
it
mean,
comes
that's
down to.
complicated,
That's what it
but we
always
can
comes
test.
down to is, how are we addressing this kid's need? We're just saying, oh, he's lazy. Oh, he's poor. I mean, right? Okay. Next one. This was interesting. This kid is on an IEP and a 504. He's on an IEP for his learning disability, but he has this severe allergy to chemical sensitivity. A little background that I didn't give you guys is that he's in middle school. He's transitioning to the high school. His home high school is an old school that has they did an analysis, has lots of chemical problems, okay? But the district went around and found the brand new school had less chemical issues and other pieces. Then they found out that they needed to have this specialist, and they were going to hire a specialist to make sure they analyze everything. They're going to have an accommodations piece. They were going to have all these things, but they can only do it at this new school that was in the district and not at his home school. Parents got pissed, took the kid out, put him in private, and then said, foot the bill. What'd you guys think? No, why?
because it's reasonable accommodation.
Yeah, they went through everything they needed to do to provide accommodations for that kid. And the ironic thing about this case, the private school actually couldn't do any better than the public school could. So I wonder about that, because we see that a lot of times with our students with dyslexia, and parents are trying to get us to pay for Denver Academy. Oh, they do such a better job. Well, if we're at least accommodating those differences and issues, then we can have that. We don't have to start footing the bill for all these things. So I thought that was interesting. Next case, what'd you learn from this one? This one is about a teen with insomnia, a teenager with insomnia.
So this is a teenager with insomnia, and the parents are requesting a 504. There's a suspicion that it may be more than a sleep disorder, so they're after more consent than they probably, it's not just the one piece of the sleep disorder. So the parent provides consent, and the district schedules the evaluation sessions for 9 o'clock in the morning, because this kid doesn't go to bed till 5 in the morning, so that was a good idea. And the kid didn't show up on those two out of 60 days
Yep.
That they had, and the district told the family, hey, you know, we can't, you didn't provide the student for the evaluation, so they didn't get their evaluation done until March, and the parents filed a due process, or filed actually OCR complaint, and OCR found in favor of the family, stating that just the school district should have known that the kid was going to be absent on those 2 days and should have made other accommodations to evaluate. And it doesn't, the kid being absent those 2 days does not give the district due cause to extend their 60-day timeline.
And this is the same rule as it is for IEP, evaluation as is for 504. If the kid's absent more than 45 days of the 60, then you can say, hey, we have to ask for more time because you did not produce the child. But if it's less than 45 days, you're responsible to get that in there. So you have to do it. And be common sense. One of the things that we had with a case that I had this year is that the kiddo was super anxious, was not coming to school. And that team had to accommodate, because the kid refused to even step foot in the school for the evaluation. So they had to accommodate and do it at a public library or at a neutral place, or even at their home if they had to, because we had to do that due diligence. Yeah.
What about, like, right now I have a student who we got consent and she was hospitalized for 2 weeks, and now she's going to residential, and they don't know when she's coming back. Do we just wait for the 45 days and then ask for the extension? And
I think when she comes back, then you're gonna, because she's not in your school right now, right?
No.
So the parent's not, the parent's not produced her. She goes past that time period, yes. Then I would say when she came back in, you'd say, you know what? And then, for goodness sakes, I would definitely get confidential, so we could talk to the residential, absolutely.
So wait for, because I anticipate her being out for 45 days.
Yeah.
And then do we?
Because you never know. Her insurance might run out tomorrow and they'll pick her out.
And then she comes back. So then, okay. Do we ask for an extension after the 45 days?
I think that you just meet back with the parent and say, hey, look, because she's absent, I just wanted to let you know that we're going to try and get this thing in as fast as we can, but we may not be up against that 60-day deadline. Mm-hmm. That has not been our issue in our district. So we're not going to OCR on those issues. On an IEP, because that's a state reporting field, we can get in trouble for that. But not so drastically on a 504. Okay, how about this one? This was interesting, this good old diabetes plan. What do you guys think about that one?
Parents had asked for a 504 for a student with a diabetes plan, health plan, and they sort of dropped the ball for a long time, and
they did.
Said it was okay because they had.
It's just like, we've had this case where a parent came in, talked to the counselor. The counselor was not the 504 coordinator. So the counselor's like, oh yeah, I'll tell the coordinator. Tells the coordinator, and it never gets documented anywhere. And the 504 coordinator dropped the ball because they didn't really know or they forgot. And so that's what this case was. Parents like, hey, I asked, you didn't do it. Okay. acid reflux. I thought this was interesting because my husband suffers from acid reflux. So, this is interesting. Is teens acid reflux a sign that he needs a 504 plan? This was an interesting case. What do you guys think?
So he had acid reflux. He would vomit a lot at school and miss a lot of school. They'd send him home because he vomited. He also had behavioral issues. So he was gone 41 days out of one school year, was failing his classes, and the principal was like, oh no, it's just because of his poor choices, lack of effort, that kind of stuff. So then they decided that they were going to try to expel him from school for all the absences.
And threatening a teacher.
Oh yeah, for threatening the teacher, sorry. And then the parent asked the district to evaluate the student for a determinant of 504.
Right.
The district refused, so this district needed to evaluate because there was reasonable suspicion that there was an issue going on with his absences and his poor grades.
Right, and because
and a medical condition.
Yeah, the administrator himself kept sending the kid home. And he even thought this kid had a disability, like, oh, he's vomiting, he's missing all the school, there's got to be something going on, but did nothing to evaluate the kid. And on top of it, because he suspected that disability, even though there was no 504, there was no IEP, and they weren't even anywhere close to the referral process, this kid had to go through a manifestation because that administrator suspected disability. Now, he was expelled because threatening a teacher had nothing to do with his acid reflux. But he still had to go through the manifestation. So that's one thing you need to know. 504, you get to that 10th day, you have to have a manifestation meeting just like you would do for an IEP. And it's almost the identical process. We still have the forms up there. Did you follow through with the 504 plan? Does it meet all the requirements? Is this expulsion due to their disability? But you have to go through the whole thing. Same. And in this case, just because you suspect a disability, they still get manifestation rights. That was an aha for me. I was like, what? Even if you just suspect? So in your kiddo, you suspect. If somebody has documentation or something somewhere that they can find that you suspected and we did nothing and the kid goes to 10 days, he's going to have rights under manifestation. Interesting. Okay. How about diabetes monitoring? What do you guys think of that one?
This happens. I could double on that, but this 11-year-old had a healthcare plan for diabetes in place to follow those things, and one of the things it says is that if they have a low, that they're constantly supervised. Mom comes in to pick the kid up because they had a low, the school reported the low, and the student was alone. So there were a bunch of problems here, not just not having a 504, but obviously they knew this kid had diabetes, they knew they could potentially have lows, and they didn't at least evaluate for the 504.
Right. And the parent alleged child find, again, back to that child find, boy, we're using that word a lot.
Yes, we are.
I mean, people really are pigeonholed preschool, but it really is the gamut. Yeah, you've got to find those kids. Okay. Was this... Yeah. All right. So was that helpful to kind of get some ideas about, I think it really emphasizes our child find obligations, right? Big time for me. That's what I thought. Okay. So moving on. So procedure, I just want to review with you. The procedure is that we're going to review them annually. We kind of talked about that. Prior to change of, especially when they're transitioning to another school, we might review those before they go if we need to. Re-eval, we do every 3 years. And we also communicate, communication of a need of a plan. If things are not going well or we need to change it, then we need to hold a new plan. You can, it's a living document. You can change it anytime you want. Yeah.
Some of the things I've seen recently, like with concussions and diabetes, headaches, and concussions, is the doctors are wanting a short term.
And that's what I was saying. Yeah, that's what I was saying about the whole broken leg or surgery.
Look at this in 3 or 4 weeks.
Yeah, we still need to accommodate those kids.
Yeah.
And I've seen some schools just write it out in a sheet of paper. And they provide, it's just, like we get from our trainer. And I don't know how how it goes at your elementary school. I know at the high school, when our kids get concussions, we get a letter from the trainer that says, hey, this kid had a concussion, please advise under da-da-da-da. I don't know if that happens at the elementary school or...
What I've seen is concussion doctors are saying, you know, the concussion's healed, but we're having chronic headaches and we're having
I still...
and vision things, and we want to give them a little modification for 3 more weeks, or 4 more weeks, or 3 months, or 2 months, or, and I, you know, it's like, is that, do we do a 504? Yeah, so it really, it's. Okay.
We don't do a 504. We do accommodate the child. And we do it in some kind of, if you want to do it in a Word document and make sure everybody's on the same page, yes, but we do not write a 504.
Yeah.
Yes.
I don't know that we've ever reviewed 504 plans before the change in placement.
Okay, we're going to talk about that procedure.
Okay.
Okay. So here's the procedure. This is a big question because I'm trying to put some procedures in place so we're all on the same page. So you write a 504. The hard copy with the signatures goes in their CUME file, a file that you keep at their school. Okay. Then you also alert the building administration. Why do they need to know? Manifestation is one reason. 2, if parents call, they need to know that the kid's on 504. Okay? Some way you got to share to make sure that they know who's on 504. You're the building section 504 provider and you are coordinator, so you got to make sure if you wrote it and you're not the 504 coordinator, you got to give it to the 504 coordinator in your building. Yes?
We just had a case where the parent did not want it in the CUME file, so what did you say about
Okay,
that?
when I say CUME file, I really do mean CUME file. You really have to have that documented. It's a legal document. So unfortunately, we have to have it in the CUME file to make sure that we're addressing the needs of your child.
So could we do an either or?
Yeah, remember, pick your battles, know what hills to die on, okay?
I guess my concern is that we have gone to the legal realms of writing a 504
Yeah.
because of a parent request. If this student were to suddenly move,
Yeah.
and CUME folder goes,
Yeah.
if I'm not at school that day, who's going to run down, find the 504?
I agree.
Throw
Yeah.
it in the CUME before it sends on.
Yeah. Do you know when I first started this job on July 1, when I ran the ad hoc, there was like 763 504s in our district? I'm like, oh, sweet, this is going to be a cake job. There's 1,500. Okay? That means 800 of them have never been sent into our office. Okay? That means we have no record. Those kids have gone everywhere in their mother, and we have no record to go with them. That's a problem. And so, yeah, we need to put in their CUMEs, and we need to have a procedure and a system in place so that we can keep track of these, and that we'll know when we're educated and we don't get into problems with OCR because we didn't know. And it's not your fault you didn't know because it didn't go. And you see what I'm saying? So we need to have these procedures.
So Jennifer, I'm sorry, but it looks like with the preventative piece, we'll be writing more section 504s in preschool where we don't have CUME files, and sometimes they're on typical kids.
Right.
So we'll have to figure out an individual plan for us.
Well, so if we get to the point, so you've sent it to the providers and parents, and I still love that idea about Wendy keeping those providers accountable, those teachers, so let's talk about that. But especially for this pre-K kiddos, we're still going to upload every single 504 to IC from now on. So the person that has the rights are the people that are the school 504 coordinators. Those are the only people that have rights. So there's one, and some buildings have 2. But one person in each building has the rights in IC to actually upload that. Who gets to see those 504s? Counselors and admin. It is not open because we couldn't put it all. We opened everybody for FERPA rights, okay? So your admin and your counselors will be able to see if a kid's got a 504. I'm still working with IT. I thought I'd have it solved by now, but I'm low on the totem pole. But what I'm trying to do is as soon as you upload this 504, you write a 504 tomorrow. You upload it to IC, and I'll show you the directions on how to do it. Then you email Arlene Williams, who's the state reporter, because she has to put that check mark in the IC field, which gets me to my 1,500. I ran the report yesterday, and I was at 1225. I'm like, woohoo! Did we write 500 in the last 2 months? No, but they got uploaded. So you're going to let her know it's a 504 for this kid and it's an annual, or it's a reeval, or we've staffed, he's no longer eligible. She needs to know what kind, because she's going to check to make sure. And if it's an annual, then she's just going to make sure he has a check mark. If it's a reeval, she's not going to do anything. She just want to make sure if they're there. If it's an initial, like it's the first time you're writing it, she has to put the date that they started one in Infinite Campus. She has to do it for state reporting. And she also needs to take them out if they no longer qualify. And then I need to know, because then I take that down, I take the 504 that you uploaded, and I make a copy, and I keep it in my folder. And sooner or later, whenever I get time, I'm going to start peeling through to look for compliance. And I'm going to start figuring out what staff development do we need? What other things do I need to support people in writing these plans? What do I need to help? It's not like, I gotcha. It's, wow, we need to, I see this is what's happening across the district. Let's train about that. Okay? How can we do that? Yes?
Going back up to who gets copies.
Yes.
On 504, this same parent did not want specialist teachers to have access to
Right.
504.
Okay.
And so the next one subs, boy, she would never want that.
So you have to, under law, we have to provide those because we're legally obligated to make sure those accommodations are being followed through by everyone that sees the student. But one thing that I asked that we change is that we're not giving the entire 504 to everyone. Just like we do for the special education snapshot, we're only providing accommodations and assessment, participation, and goals. For a 504 kid, all we're providing is that last section, which is the needs and accommodations. That's all they get. And that's all they need. And that's why I made them separate, so you can break them up. Separate sections, okay? So to upload 504, how many 504 coordinators do I have in this room? Any? Just one? Coordinators? Yeah, that you're the official. Kim, yeah. You're the official? All right, so you two I'll show later. Instead of showing all of you. I had a whole room of them, and I'll show the two of you how to upload them, okay, later, so I don't bore the heck out of everybody else. Okay? So we have a working checklist. I put this together because, and I don't have my thing on, but I'm very blue-green. I'm Merge Genetics, very blue-green. I have very little yellow. So I'm all about structure and data, okay? So when I was looking at, okay, what do I have to do in my job? I gotta build some structure. So I put this working checklist together to help everybody be on the same page and guide people. So the first thing that we're going to do every year, and you can do this now if you're the 504 coordinator, you can run the ad hoc to find your 504 kids in your building. And then from that ad hoc, I want you to compare it to the ones you have physically in front of you. And if there's a disconnect, I need you to upload those to IC and let Arlene know so we can get those kids state reported. I can't believe that we only state reported 700 kids when we have 1,500. It's crazy. And now, because we haven't done it, now Arlene and I have to explain to the state why we wrote 700 more 504s in 1 year. They're like, oh my gosh, state reporting. But it's okay, we can explain it, but we have to. So run the ad hoc, find them, let her know. And if there's some in there that shouldn't be in there anymore that were staffed out, she needs to know that too, okay? So you would really help me out with that. Create a calendar, annuals. Now it's not like the anniversary date like an IEP. You know, if I wrote it in September, then every September I have to review it. If you review all of them in the beginning of the year, because that's what I'm hearing a lot of schools do, or all at the end, or whatever you do, I like it more in the beginning, you decide on, as long as you are reviewing that annually. If it goes for more than a year and you haven't done it, there's some problems there. And that's why on the new plan, I actually have the date you wrote it and the date that it's good till. So you know when, hey, I gotta do that, I gotta review that before then, okay? So create your calendar and then find out how many reevaluations you have that year. How many do I have to review eligibility? And it might be none, it might be all of them, depending upon what documentation you have. So you're gonna have to look at that and find out what you got. to determine where you are with reeval. Then schedule the meetings. Of course, this will run you through before an annual. Make sure you schedule it. You send the parents the notice of meeting. You send them the rights. Then you get your section team members with, remember, knowledge of the kid, evaluation, and the needs, okay? Then after the meeting, or at it, you review the plan, update the accommodations, review dates if necessary, make necessary updates to dates, okay? Before an initial or re-eval, obtain written notice of consent for eval if you need it. Remember, it's going to be less than 2% of the time that we actually will ever need that form, but you might. Select your 504 team members, gather up your evaluative data, have the meeting, go through all the process, okay? Gather from a variety of sources. Then you can, at the determination, you can say, I either find them eligible, they might be eligible for 504 protection. Now, this is one thing I want to tell you. A student can qualify for 504 protection, but not need a 504 plan. So, could be like the kiddo with cancer. They qualify for the 504 plan, but they may not need accommodations at that time. But you may revisit that at any time that they need those things. But they're covered under the 504 protection just in case they need that protection. And that's really about manifestation. And it's always about making sure we're not discriminating against that child. Yes? Because you would find them eligible, and then down in the accommodation section, you would say, at this time, even though the student qualifies for protection under 504, does not require an accommodations plan. It's so rare. It's so rare in our district. It's so rare. But I want to let you know. Yeah, why? Yeah, I would put why. Mm-hmm. It's so rare, we hardly ever do it. So then after the meeting, of course, distribute a copy to whoever, go through, notify via email to Arlene and I, monitor, make sure you progress monitor. And this is the biggest piece. At the end of the year, we're going to identify all the 504 kids, because now, hopefully by the end of this year, all the 504s will be uploaded. Okay? I know you got a lot. And if you have not turned any in, which you're not, I wanted to say, you're not alone. You're not alone. When I did this, again, those procedures were not ever spelled out. So it's not your fault. But you're not alone. I had this gal in the training just a couple weeks ago, and she goes, oh my gosh, Jennifer, I just ran that ad hoc. I have no 504s. I'm like, awesome, you. She's like, I have 64. I was like, okay, well, you'll be uploading some documents. Okay? So it's okay. We know it's been inconsistent. I get it. But do I want you to do it all tomorrow? No. Do it as you can. And I don't want you to go back and use the new form for the ones you've written this year. Fine, upload those. Upload evaluations. Upload anything that you think would be necessary that you, as a counselor or a teacher, would want. Up to the 504 documents. Because what if they're moving? Wouldn't you want to have that evaluative data? Wouldn't you want to have that information? I'd want it. So upload that stuff in that 504 file, okay? But don't go backward, just move forward with using the form, okay? Move forward with the reevaluations, move forward with, and get those uploads done when you can. I just need to get them in. I'd like to get them in before December 2, so we have them for a December count, but I'm not gonna put a hard line on that, because I can't make you guys do something a process that we just put in place. I think that's too demanding. It's just ridiculous, okay?
If a psychologist did a complete evaluation on a student, you want that entire evaluation uploaded into their IC?
In the 504 document, because you know why? Only the counselor and the administrator will have that information, and we'll need it. Because what if the kid up and moves to another school in a week? Wouldn't you want that information? I think it's important. Okay. So that's that working document. And now, We talked about manifestations already. I showed you the FAQs about drug and alcohol. Good reading. But just remember that we do have those manifestation rights. BIPs, there are a lot of kids that have 504s and BIPs. It's okay. Consult your mental health team if you need help with writing BIPs for the kids. By all means, you're not responsible for writing it. Get help with that.
Can we use any paperwork, or do you want paperwork that we would use for an IEP BIP?
You can't use the enrich BIP
Okay, that's what
because
I didn't think so.
they're a gen ed kid, but there are BIPs out there on the mental health website. Yep. All right, so we talked about actions after this. You're going to do the run the ad hoc, use the DCSD forms only, and then use that checklist. Hopefully that'll guide you. Again, if you're needing some more site evidence, all you 504 writers in this room, it's great for standard 5.5 of writing, of delivering and supporting legally following the law, federal law. I can't remember the whole phrase, but it's 5.5. I know it is. All right, so summative. So we have, 10 minutes. So what I like you to do for your summative, and I'm going to check the summatives. I'll give you guys a week to finish the summative, but this is what I like you to do. You can spend this 10 minutes, which you really could get it done in 10 minutes. You can do it together in a group and just copy the summative assessment, put all your group members' names in it, and then share it with me. So it doesn't have to be done by yourself. You can do it in a group. You're going to analyze the 3 cases that I have here and tell me next steps. What do I do now? Okay, there's 3 cases. You're going to analyze those and say, this is what we're going to do. We're going to go to evaluation, or we're going to send home a notice of meeting, or we're going to, whatever it is, okay? And then I'd like you to take, after you do those 3 cases, remember, copy that, put everybody's name on it so I know who to give credit to. And then for the final piece, it's taking a 504 plan from your school. I want you to rewrite the plan so it's a quality compliant 504. So you're just rewriting the plan. I'm looking for, and you can make it up, you don't have to go by it, but I'm looking for those sections that talk about evaluation, that talk about the impact, and especially what I'm really drilling down to is the needs. Because what I see a lot is accommodations and not needs. And I'm going to go around and I can help you if you're like, how do I phrase this need? I don't know how to phrase this need. Can you help me with phrasing that? Or I don't know what this is addressing. I can come around and help you with those 504 plans, and I can give you feedback on it after you're done if you don't want to do it right now. But this was really helpful. We did it in the last class, and when they rewrote them, they're like, oh my God, this so makes sense. So makes sense when we saw a real one and we did it.
You'll give us feedback on how far off we were.
Yeah, absolutely. Okay?
Ask one of my counselors to give me the Word document template.
Yeah, and I have paper documents that if you just want to rewrite it on a paper document, I have paper ones, or you can go to the SPED website and do it on there. Yeah. Yeah. You want a paper one, or you want to do it? Okay.
And Jennifer, can you show me how to upload? And then I tried to run an ad hoc and it won't go.
Question.
What if it's the exact opposite of that? Not that not everything's great, but the kid just doesn't use any of his accommodations.
So if they're not using their accommodations, does he need the accommodations?
According to his doctors, now he does.
Okay, so that's where we're going to talk about that. 504 team makes those eligibility decisions. And hopefully we're taking some data on those pieces. And hopefully we're looking at all those pieces together in eligibility. So after we get our consent, then we've got 60 days to collect and review body of evidence to demonstrate limited access, outside evaluations. Then we sit down and we determine eligibility. So the first page of the new form is just the signature pages, and parents get the rights. The second page is the eligibility decision questions. So here's the process. Let me bring up that form so we can kind of look at it together. Oops. So I changed it because people were saying, oh, Jennifer, I really want just the first page to be signature pages. I want to pre-print that and populate it and print it off. Okay, great. So I changed it. So if I'm looking at the Okay, so the first page is making sure that parents got their rights, so you have them sign. Then the second section is the eligibility, where you go through and say, do they have a physical or mental impairment? Put all your evaluative data in there. And you can even attach it, 504 stuff, all those other pieces of evaluated outside diagnosis. Put all those pieces together and you can attach it to it. Then, does the student's documented impairment impact the student in one or more areas? Then you identify those. You discuss those and you check those based on your evaluation. Not because, like in this scenario they use with the parent performing or caring for oneself. I was like, no, it's not impacting caring for oneself, okay? So you talk about what the data shows you and how it impacts these pieces, okay? And then you go through the next question. Does it substantially limit this major life, and how does it? Describe the impact considered. So you're going to talk about the impacts. And then does the student have, does the identified disability impact their access to gen ed? So it could be impacting a major life activity, but yet it's not, in that case where he's straight A's and it's not impacting those pieces, you would answer yes all the way down to 4. Does the identified disability impact the student's access to gen ed programs and services? No. If one of those questions answers is a no, they're not eligible. And so you go through the eligibility. Now here's where we're stuck, is that we haven't had good processes. I know this, you know this. We haven't had the same form. Everybody uses their own form for some reason. And we don't have any documentation of when kids got on 504s and when they didn't. So I'm not saying, all right, guess what, guys, you're going to do reevals, every one of you. What I'm hearing is a lot of people were doing eligibility reviews every year because they were filling this section out every year. And so in that way, it's an eligibility review. You're looking to make sure they're still eligible. But legally, we only have to do that every 3 years. So, but because if you don't have any documentation of when the last time or the first time the kid was reviewed eligibility, then I'm going to ask you to do it this year so that we can move forward from here on out to say, hey, I don't have to really revisit the eligibility for another 3 years. Okay? If you have documentation that they went through that eligibility criteria and they did it last year, then you're good for another 3 years. Then when you go through your form, to the very bottom where it says reevaluation due by, just put it 2 years out because they did it last year. Do you see where it says reevaluation meeting date? All right, they found the kid eligible last year. They don't need it for another 2. I'm trying to reduce your workload so you don't have to do that. We only have to look at eligibility every 3. Does that make sense? What if you're staffing a kid out? You said maybe they're not going to qualify anymore. Then you go through those questions and you say answer no for one of those and you stop. That's all you send in is the eligibility section. No longer eligible. So when you staff a student out, same thing like an IEP, you still have to go through eligibility to say, you know what, they don't ever qualify. They don't just get off a plan. We have to staff them out. We have to find them no longer eligible. We have to do that process so we have that for state reporting. That we can prove that we went through this process, because that's where we've gotten in trouble. We've gotten an OCR problem with disability discrimination because one school said, he doesn't need it anymore. He moves to the next school. School B doesn't even know he was on a 504, right? How many times does that happen? And then the parent claims discrimination because there was no formal eligibility to say, no, your child no longer qualifies. They just decided he's not using those accommodations. Yep, you're good. Okay? Does that make sense? Is that new? Kinda? Sorta? Yeah, that's been in the law for a while, but I don't think anybody's ever taught that process. Yeah. No. All right, good. We're learning something. I'm excited.
What about if maybe he still qualifies, but the parent says we don't want him on it anymore?
Yeah, if the parents say we don't want, then at the time where you can still find them eligible, and down where it says accommodations plan, you could say no accommodations plan needed at this time due to parents not following through, or doesn't want the 504, or doesn't consent to that, or all those pieces. So you put that in the plan part. Question?
I just want to make sure about the evaluation process. So
Yeah.
if there is something that comes in privately, say from Vision, which is what I tend to get a lot.
Okay.
So as a person who's helping with the 504, is part of that evaluation my job to not only I interpret it, but do I need to also do a ton of other of my own evaluation, or can I just
Only
put
if
that
you
in
feel like you
interpret?
need it. Only if you feel like you need it. If that outside diagnosis tells you enough that shows that they have either physical or mental impairment, and it's substantially limiting one of those MLAs or MBFs, and it's also impacting them access and participation in gen ed, if that's enough, then you're good to go. If you go, that's why I'm saying I'm worried that people are just getting these diagnoses and not really understanding them and going, oh, doctor said, I'm just going to write it up. Right? Okay, question?
Yeah, on the flip side of that,
Okay. Give it to me.
What about when you get the doctor's note and you're pretty sure they paid the doctor off because you don't see any of that?
Perfect. Thank you for that. Thank you. Okay, so the question is, what if I get an outside diagnosis that is not founded in any evidence or any evaluative data that you have? Then I would say it's your due diligence as a team to make sure you have enough data to say no. Because outside diagnosis is one piece of the evaluative data you use as your team to determine eligibility. It's not the end all be all. But I would tell you to avoid OCR. Please make sure that you have enough evaluative data that really compounds that team to say, or compels that team to say, no, we have so much data that says otherwise. Okay? I would say, again, going back to Jason's comment, we are not going to die on a diagnosis, and we're not going to die on whether it is 504 or not a 504. It's always about addressing kids' needs, right? That's always in our head. Okay, so we develop a plan and found eligible. So who is on that Section 504 team? Well, the Section 504 team, and I hope if anything at all that you learn is this piece, because I think this is the practice we have to improve on. A 504 team can be person has knowledge of the kid, right? Person has knowledge of the evaluation. Remember we talked about knowing what that evaluation from that doctor means. And a person that understands the needs of the student and can plan services / placement accommodations. For many times, especially at annuals, when you're just reviewing the plan and not the eligibility, can that counselor be that person? Just the counselor and the parent and the kid? Yeah. Will the counselor know the kid? Yep. Evaluation, not necessarily necessary, but she needs evaluation from progress monitoring. Does she know that? He know that? Yes. And do they know the needs of the student? Yeah, so it could be that one person. But when we talk about eligibility, maybe that counselor may not be that only person, or maybe that counselor did their homework and asked all the right people about the evaluation and can still do it by themselves as long as they have knowledge of that evaluation. Okay? So that team determines the eligibility and writes the plan. That team will differ depending on kid, on grade level, on school. It doesn't matter. It's not a designated team. You don't have to have a gen ed teacher at every meeting. It doesn't have the same legal requirements like it does for an IEP. And you don't even have to have the parent. It's actually legally not put in the law. Do you want the parent? Yeah, but it's not required by law. Okay?
Jennifer, I guess the only thing that I'd say is I would think that our best practice, though, is that it's not a counselor sitting in a room.
I would agree. I would totally agree. Especially at an eligibility meeting, I hope it's not just a counselor, but that's been my 5 experiences. It's like, wow, this is an eligibility meeting? Where's everybody else? It's just me and you? Awesome. Okay, we really need to change our practice with that. And I agree with Wendy. Our best practice is getting those people here. All the people that know the kid, have seen the kid, have evaluative data on the kid, can talk about and address those issues if parents say or doctor says this. It's so important to do that at the get-go so that we really create a good plan. Yes?
So then is the school team section 504 coordinator not required to be at the meeting, but that is best practice as well for eligibility?
Yeah, I would say. Absolutely. Absolutely. So these are people that could be team members, and as I said before, best practice include parents, but it's not a statutory requirement. And I'm talking about not for eligibility, but I'm talking about for reviews, okay? When we're just reviewing it, parents, we can do that over the phone if we're not making changes and they're okay with that. But you still sent the notice of meeting, like, hey, we gotta have a meeting, and they're like, oh, I can't make it. That's totally okay. But we still have to go through that practice and getting their input. Question?
If you just change the date on the form,
Yep.
I mean, what about the signatures?
Oh yeah, you'll get the signatures, yeah. You'll still get the signatures from this year. And so you'll do that page 1, and then you'll just, say for example, you wrote the plan on the new form, okay? And hopefully you're going through the eligibility because we don't know when that was done before, or you're just rewriting what the eligibility was done if it was done last year, and you have documentation of all that. You would redo that, you put your dates in, and then next year you would just print off page 1, and you would print off the accommodation section, which is the 3rd section, and you would just change the dates. That's why I made it a Word document, so you can have it as a Word document and just edit what you need to do, put your new dates on it, and resubmit.
But if there's nobody at the meeting, we're just changing the dates.
You still need to say who's the one that met about the meeting. So if you talk to the parent on the phone, or you sat with the kid, or if you, whatever, you still put those people as participants. And if the parent wasn't there present, then you would say video conference, phone conference, discussed with parent through whatever.
We have had some serious trouble with teachers not reading 504s.
Yeah.
And so as a school, we have a signature page that every teacher has to sign after the 504 is written.
I think that's great.
And it's part of that 504.
Perfect. I like it. I've seen it in other schools too. I can't impose that on everybody. I can't. I asked about that because I thought that was a great idea when you brought it up, and I saw another team do it too. It's like they have this extra sheet that says, I have been given the 504 accommodations and understand what I'm required to do for this child. It's like that's what it says, and it has signatures, and I'm like, oh, love that. Love the fact that they're building in that accountability. I love it. I can't require it, but I think that's great practice. And I think that if you can share your form with me and how you do that, I was going to ask that other team to do it. I'll put it up on the special ed Google site and people can use it because I love that idea. Absolutely love it. Thank you. Okay, so qualifying needs. So again, now we're in this section of needs. And this practice has to change drastically. So if we look at our 504, okay, somewhere here is my 504. Sorry. I was just viewing it. That's why I didn't have it open. All right, so in the 504 section, we have now determined them eligible. We're starting to write the plan, and then there's really just 2 components of the plan, is needs and corresponding accommodations. Okay, so now we've determined them eligible. Now we have to find their needs. So the needs goes here. Describe the needs as related to the identified disability. So those needs come from that evaluative data. That's why evaluation is so important. That means that's why a doctor's recommendation is not enough, because we have to identify those needs. It results in the substantially limiting MLA. So what I try and tell people is when you're identifying the needs, make sure they align with those MLAs or MBFs that you picked. Okay? And we really should focus on skill deficits and barriers to access. Okay? So those are needs. And then we get to accommodations. We do corresponding accommodations identified to the need. And so we look at accommodations that are involving changes in presentation, manner of response, setting, and all those other pieces. We know what accommodations are. Boy, we do that well. Boy, I see laundry lists, let me tell you. Okay? So It involves changing the presentation manner response. Now I want to bring up, it's part of our plan here, I'm going to skip down to this example. This is a 504, and I took this 504 from a current 504 as I'm starting to learn more about 504s and what our 504s look like in our district. But I changed the name to protect the innocent. Awesome Elementary, Jane Doe. Sometimes I don't even get LACID numbers. I'm lucky to get a birth date, but sometimes I don't get LACID numbers. We never had that before, and hopefully I got the date of, okay? So if I come down, this is what I get in, whoops, I gave you the compliant. Hold on, wrong one. Jane Doe. Where's Jane? Come on, Jane. Jane Doe plan. Okay. Sorry. Don't tell me I fixed this one too. Okay, this is what I get. Okay, I get one person and the parent, oftentimes, like you're saying. That happens a lot. And then when I get down to the eligibility, I get that. Outside diagnosis. Wow, that's it. I take it hook, line, and sinker. Thank you very much, and I'm on my way. What happened to all the other evaluative data? How are they doing in class? How are they doing in school? What are they doing? What are their TCAP results? What are their maps? What are observations from teachers? I mean, it's like, wow, really, that's it? Outside diagnosis. Well, that told me a lot. That's a lot of evaluative data. I can pull a lot from there. And what was it? Of course, they probably attached it, but I don't know. Okay? And then I go down to, does it impact? Due to ADHD, Jane cannot concentrate. That's her impact. That's it. That's all I got. Now, is it bare minimum? Yeah, but wouldn't I want to know how she's not accessing her general education or her curriculum? She can't follow tasks. She can't organize her stuff. She has problems. I mean, that's bare minimum, folks. I mean, is it compliant? I guess. Okay, and then this is where we really have some problems. This is what I get a lot. I think this is the practice that I want to change. Let's take a look at her needs. She needs to organize material. She needs to use a planner. She needs extended time. She needs prompting to stay on task, and she needs brain breaks. Sound pretty good? What are those? Those are accommodations. Are they her needs? I go back to, why does she need to organize her materials? Why? Because she has executive functioning issues. She can't organize her thoughts. She can't organize anything. Those are her needs. She needs to be able to learn those pieces, okay? Use of a planner, is that a need? What's the need that would go with that? What does she need? Skills for organization. Again, skill deficit, right? We're looking at the skills that she needs to build. Skills is she needs to learn, she needs support in skills and organization. She needs support and skills in time management and organization of her assignments. She needs, what's extended time for? Why do you think she might need extended time? ADHD kid, why would they need it? Yeah, their mind's somewhere else, and it's taking them longer to do the assignment because they get distracted a lot, and it takes them longer to concentrate, so they need what? They need time to process. They need time to complete. They need time to do these things due to their concentration issues or due to the way they organize their thoughts. For an ADHD kid who can't organize their thoughts, it's going to take them twice as long to write an assignment, potentially. So that's their need. Brain breaks. What is that really saying? What's their need? That's an accommodation. What's their need? Needs physical activity or movement to re-energize their focus. That's what they need. It's hard. It's hard to make this shift. Do you see how hard it is? But now when we look back at that list, don't they look like accommodations to you? Okay, great analysis on that. So if I were to look at Jane Doe, what I think it should be is when we look at the 504 eligibility and plan, we want to look at due to ADHD, she struggles to stay on task, pay attention, concentrate on task, organize her thoughts and assignments. Isn't that more information than she can't concentrate? Back up to the evaluation. I kind of skipped that, sorry. Back up to the evaluation. Outside diagnosis of ADHD from physician, pattern of issues with attention, concentration, classroom observations, teacher and student parent checklists, interviews to indicate issues with concentration and lack of organizational skills in the classroom, and writing work samples. I took all those pieces of information. I found all of, that's my evaluative data. We're doing this anyway, but we're not documenting it. I'm not saying we're not doing it. We are. People just are not writing it. Does that make sense? That really helps us lead us into the impact and helps us lead into those needs. I've got all that evaluative data. Now if I go to my needs, okay, I have strategies to support attention to task and learning concepts, and that's what she needs. She needs strategies. How am I going to pay attention? She needs organizational skills to improve organization of thoughts and assignments. She needs time to process information due to lack of attention and time it takes to organize thoughts, physical activity to time to refocus energy or regulate attention. That's what her need is. Now, how are we going to address it? That's the accommodation. That's the corresponding. So for every one, and sometimes you can number them or you can bullet them. So strategies to improve attention, how are we going to do that? We're going to prompt the teacher by tapping on her desk or her folder or her shoulder to refocus. Positive reinforcement when Jane is attending. I know those are really small, so let me, and the examples there. Sorry. Whoa. I just went crazy. Okay. Seated in proximity or a natural flow pattern of the teacher, right? Doesn't have to be always in the front, but if it's in that flow pattern of where the teacher's going. Use of headphones during independent tasks to try and zone out. Sign planner by teacher, extended time, and let's be specific on how much time, especially if we're asking for accommodations on Park or CMAS. And then also tell me what subject areas, because that makes a difference, and that'll help you when you get to collect all your data to ask for accommodations. You already have it written in your plan. Because she doesn't need it in math. She's a rock star in math, but she needs the extended time in language, arts, science, and social studies because there's a lot of writing in those. Okay? And then permission to take mental, physical breaks, less than 5%, 5 minutes, excuse me, by going to the bathroom, getting a drink. Permission to do those things. If you notice, I didn't put any as needed. How many times have you seen as needed? Okay? My comment about as needed, they either need it or they don't. Okay? They either need it or they don't. What you can do is take data on it. And if you find that they're not using that accommodation, or if you need to restructure that accommodation to that way, you can do that. But you don't want to say as needed. Either they need it or they don't. And these are things that teachers are doing. Teachers are providing. Okay? Adults are providing these accommodations. Question?
I guess the only thing I was going to say is most of the time I don't write as needed, but there could be a time like if you have a diabetic student, they might need accommodations as needed for their blood sugar or something like that.
But they'll need it. It's not as needed.
When needed.
Not when needed, it's just they need it. Are you the accommodations Nazi that says you can hear and you can't hear, or, right? We're not. No. We're not the accommodations Nazis that say you can only get it when you need it.
Okay.
If they need it, they need it.
But I guess sometimes
You're
I'll
not
say
going to give them food every day and like, you know.
Then be very careful on how you write your accommodation. Be very careful on how you phrase it. because what you're writing is what you're providing.
X amount.
Okay?
Can you say
You can, so the question is, what if it's an as needed? How you structure that is when you write the accommodation given, so this is a good example, given a time where her low blood sugar goes, student will, whatever. Or, not student will, sorry, going to an IP. But given this situation, the student will get this accommodation. That's how you structure it, so you get away from that as needed. So just like given an independent task, she's going to have use of headphones, but she's not going to get it every time. She's not going to have her headphones on during instruction, but I'm giving her it during, I'm structuring when she's getting that accommodation. Given this situation, this setting, this piece, this is the accommodation that will go into place. Does that make sense? That way we get away from that piece. Because who defines as needed? We don't want to define it. Yes?
What about when requested by student?
Yeah, so even the teacher's giving it or they're not giving it. Okay, do we want to build a level of capacity and independence and advocacy for kids? Absolutely. Right. Then we structure out the accommodation. We don't ever want to write an accommodation of, I always say, don't write accommodations for things that kids can do themselves. They can do it themselves, then don't write the accommodation. If that's not what's helping them access and participate in Gen Ed, then don't write it. And it's not on when the student requests. You take data on it. I'm going to give you extended time, and if you never use it, then let's talk about it at the 504 next year. Wow, I gave extended time. I offered, we have all this data of OBR, offered but refused, did all these things, and yet he still progressed. So I don't think I need, my data shows he still progressed and he didn't use extended time. Does he still need it? Does that make sense?
It does.
Okay.
We just had one that, like, especially for ADHD kids, when you give them extended time and then sometimes they wait until like the last minute and then they go,
I'm so glad.
Time. So how I've been writing it is that the student will show the teacher adequate progress toward completion of the assignment, and then extended time will be given. I mean, so they have to be doing something, because then otherwise it snowballs and then it creates anxiety, and then we have an anxiety problem.
I'm so glad you brought that up, because that's been brought up almost every question is about, what about projects? What about this? I've had extended time on assignments, projects, and and especially on projects where I say, okay, you get extended time, the kid blows off the project, the day the project's due, oh, guess what? I get extended time, haha, I'm gonna turn in tomorrow, I went trick-or-treating or whatever, and right? No, so I've seen, and how it really works well is when you put in parameters around those projects. So the way that this team and I did it, I thought was really brilliant. And it wasn't my idea, so I wish I could take credit. But it was like within 24 hours or 48, whatever they decided, of a project being assigned, parent, student, and teacher will indicate how much extended time will be given for that project within the time they assigned it. So they assign this big project, and then the teacher and the parent and the kid email or call or whatever they do, and they go, okay, I just assigned this big science project. I want you to look it over Johnny, see of all the things that he's struggling with, what do you think? I think that he can probably do it with like 2 or 3 days extra time, and you're empowering, that's that collaborating with kids, good old standards, site standards, but you're saying, hey, how much time do you really think you're gonna need on this? It's helping advocate for themselves to go, wow, this project's hard, I'm gonna need a little extra time here. Or, I got this, I don't need extended time. You're helping build up that capacity for kids to understand and advocate for themselves, but I love the fact that you collaborate on the time at the time the project's assigned. And you are specific enough as you can in the accommodations, how much time. When we say time and a half, I could be more specific and say 2 days after assignment, 3 days, especially with kids with healthcare physical issues like seizures or pieces that they miss school. They have an accommodations plan because they miss so much school and they need that extended time to get caught back up. And so I think you have to be specific about those pieces when they miss school and all those other pieces. Does that make sense? Thank you for bringing that up. It's a question that comes up all the time. Question?
With teachers often get frustrated because these kids have missed so much school.
Right.
And it's like, how do you make up the instruction, you know, the home assignments, classwork, homework?
I think at that point, it's good to go back and review the 504, find out why he's missing so much school, put in a plan in place. Like, yeah, I mean, it depends on the kid. If it's due to anxiety, then what are you building capacity for him to be involved? Is he missing school because he's so anxious he doesn't go to school? Or health-related pieces? Are there certain content areas or assignments that can be waived? Certain things that can't be? Are there alternate ways that kids can to demonstrate that they learned it instead of doing all this paperwork? I mean, you can be creative in how you look at those pieces. Again, we're trying to meet the needs of the kid.
Right, but ultimately they have to meet the standard.
Yeah, they do need, that's what I'm saying. If you have alternate ways to demonstrate your learning of the content material.
I guess I'm the nurse and I don't really know that.
Well,
right?
But you're one person of a team, right?
But the teacher should know what they can minimize.
But I think you should be creative. I think you could be the creative juices in that group and go, hey, let's look at other ways. Do they actually have to do all 15 paper assignments? Or is there another thing that they can do as a performance assessment or something else that can really sum up all these things to really demonstrate they understood it?
But the teachers do that. They do that. But the kids miss 30 days.
Well, I think every kid is different. You have to look at those pieces.
I don't have,
yeah.
you know,
There's no cut and dry answer I can give you on that one. Sorry, Michael.
So, I heard you say, be careful what you put in the plan, see what you're offering. So, for example, in this one, where you're saying, signed plan by a teacher, coordinating folder, organization of assignments, weekly check-ins. You have this whole laundry list of things that are on there. And what if the parents come back and say, guess what, you didn't use graphic organizers, with the discrimination, because it's in my 504 and no one ever used that with my child. So I'm just wondering, is it better to be that specific with your accommodations where you're putting all these different things in? Because that's good practice to say, here's a lot of ideas.
Right.
Or is it better to be more general and kind of let the
I think it's good to address them specifically if the student needs it. I do agree with you that you don't need to have a laundry list. How many times have we seen parents come into these 504 meetings from things they've Googled online that say, oh, I need these. I have ADHD. Ooh, here's my Google list. And slide it over and expect all those accommodations. But when, in this case, this kiddo really needs graphic organizers. And if we're not providing those for her because that's what she needs, then that is. We're not following through with the law, which is this plan. And that is a problem. So that's why it's so, when Wendy brought up accountability, those teachers need to know what's in the plan and they need to be a part of the plan and say, oh yeah, I can do that, or no, I can't do this. But if you're so general, then it can also lead it wide open to interpretation that you can get yourself into trouble too.
Yeah, I'm just thinking of just trying to also think about resources. I mean, when you have limited, counselors that, if you have 400 kids or something like that, as opposed to a special education person who might have 12 on their caseload.
Right.
So when I write these, sometimes I think, can I really do this? It might be, and I have to balance with, this might be something they need, but do we have the resources at the school?
And that's why you need more 504 team members to ask those teachers, what we're writing in this plan, is it doable? We don't like to put accommodations in that are not doable. Your team needs to be able to do those, and not something that's so long-standing or long-term that it's now boxed us into something. I agree. You have to, this was a 504 team decision that the English teacher's like, yeah, I can do writing, and I've got actually drag and dictate on the iPads or Chromebooks that they have. And yes, I have headphones that they can use. And yes, I have all these pieces. I would never finalize a plan with us, knowing that people can actually follow through and do these things. And that's the important part of why you need them involved. Yes?
Well, I'm going to piggyback off what he said, because I am so glad you brought that up. Because I've had 3 of 504s this week. It's kind of my month to and it dealt with a kid with ADHD, and he needs organizational skills. And today, the school social worker who was in my meeting said, he needs organizational skills. But I can't guarantee that I can give it to him every week or a specific amount like you said. I know there'll be times I miss that. So when I come to the broad definition, I was advised to say make that broad.
Okay.
He will be given tools, organizational tools. Because then that way they can't come back and say you didn't meet with him every week, you didn't do this, you didn't do this. Because that has happened to me. I screwed up a 504 last year. It applied in summer school. The summer school teacher didn't follow the wording.
I hear what you're saying, but what I also feel in my gut is we don't write plans based on what will fit into this box or this program. We write plans based on that kid's need. If they truly need it, then we need to address it.
So it is our job as a counselor?
Not your job as a counselor, your job as a school. You're talking all your gen ed folks and your people that offer those resources to provide that stuff. If you even said that kid does need organizational skills, who's going to provide it? Who's going to help them? It's not your job alone to do that.
And I don't disagree with you, so don't get me wrong.
So I think that you have to look at, there's a fine line between, if I didn't give him the skills that he really needed, then I'm going to be finding myself liable for discrimination anyway. So I need to provide that. Yeah, does it have to be 3 times a week? I had parents like, every day you're going to pack them up. And I was like, whoa, hold on, that's not long term. That's not withstanding. And they actually wrote it in the plan like, first 2 weeks, we're going to check in with them every day. Second 2 weeks, we're going to check in once a week. Third, quarter, fourth quarter, we're going to do it once a month. They stepped it out because the parent was so insistent on those pieces. And they're like, yeah, well, we could do that for this, but we're going to step this out because we know that we're going to be teaching them these skills, and therefore I can fade out after a while. But being so general that, okay, who's responsible? That's why we put who's responsible? Principal's responsible for providing those organizational skills. Who's doing it?
Well, that's my question is the teachers, I don't have the capacity to do that.
They have to, by law.
So do I put that on the teachers?
Yeah.
Is this just classroom accommodations?
It's classroom, it's lots of different things. It depends on what you're doing, yeah. But that's why teachers have to be at those meetings, because they're the ones following through with the plan. You're writing it, you're facilitating it because you're the coordinator, but you're not providing it all the time. I'm not saying that everything on this 504 has to be provided by you, the 504 coordinator. This is why it's a team thing. That's why you want gen ed people there to say, hey, this is what we do already. You know what? They'll sit in that meeting and like, oh, we do organization first thing in our class every day anyway. That's perfect. We'll just step this out and make sure he does it. They might be doing it already, but then if you don't have their feedback, how do you know?
And I would say if it's that bad, then you should be going to your SPED team and say,
yeah, if it's
maybe
to that
it needs
level,
to go to a higher level. If they really need that kind
depends,
of
right.
organizational skills, then
yeah. But yeah, you shouldn't be.
It's not that bad, and it's not something that I.
No, but I think you can step it out. So that's how I've seen people do is they step out they fade out that piece. They'll still provide that accommodation, but they'll be really intensive and they'll write that in the plan that within the first 2 weeks they're going to do this and the next whatever. I see that in a lot of elementary plans. I don't see that as much in high school plans, but yeah, if they have that need, we have to address it. And it's not you, it's
right.
The teachers.
May I ask you, and without going too much farther,
okay,
just to give me an example. Let's say we don't know what kind of skills he needs. He needs organizational skills. We don't know what exactly. We're in the 504 because we determined that he needs some sort of organizational skills. We still don't know what it is.
All right.
Nobody does.
Okay.
How would you write that into?
I would stop the meeting and go, you know what? I don't think we have enough evaluative data. I need to go back to my teachers, or we need to go back and we need to do some observations and we need to get some more information to find out where he's lacking in his organizational skills. If you don't have it, don't write it in the plan. Stop the plan and go, you know what? We're going to have to reconvene this later because we need more stuff to make sure that we have a plan that's right. And just one more thing about accommodations, and this is why I really want us to go to needs, is that we have to be able to always go back to the need and the evaluative data. I sat in a 504 meeting this year, and this parent wanted, she wanted, you're the science teacher, and you're going to put all my daughter's assignments on blue paper. And you're the English teacher, I want all of them on yellow, and you're going to be green. And I was like, what? Oh yeah, I'll buy the paper. I was like, okay, no. No. First, that's not a reasonable accommodation. And let's talk about, why do you feel like she needs to have color-coded assignments from these teachers? And it was just for her, not for all the whole class, just for her. And she said, well, she really has a hard time with organization. I figured if all of her assignments in yellow are always English, then I was like, okay, so the need is organization. So we went back to that need. How else can we address organization? How else? Oh, we'll do a folder. We'll do color-coded folders and they go in there. Oh, we'll do this. But it was like, parents will come in with laundry lists and unreasonable accommodations. And I always say to teams, I was like, when parents come in with all those pieces, go, okay, why do you think they need that accommodation? What need, back to those needs, that's why it's so important. What need is that addressing? What need is it? And where's my evaluative data that says she needs it? So that's why we need to really change our practice of our evaluation, our need identification, and then we can start trimming down. So I see the ones that I've seen so far, they have plans that have like 4 accommodations, which is okay, or maybe 2, and then I have that have 25. I was like, whoa. This level, why aren't they in sped? Okay, so I think that we have to find a happy medium somewhere and go, okay, when we're sitting and meeting with parents, all right, what need is that addressing? Hey, how about we do this? It's more reasonable. It's more has more longevity to it. Because those things that she was talking about would not sustain very long, no sustainability. And she's going up to high school. What high school team's going to do that? Again, sustainability, long-term planning. I always bring in, how's that going to happen in middle school? Oh, how's that happening? And what's it going to, we look at those pieces for long-term. Yes?
How do you suggest handling those that come in with the Google 504, expecting us to just sign it and move on?
Right.
When you start to go through those point by point with them, so that you're, maybe, there might be some great ideas. I found great ideas.
Mm-hmm. Yeah.
But they want everything.
Right.
So how do you, when you try to go through that and say, what do we really need? What really do we need? And they're not happy with what we're feeling is what they need, when it's not everything. And
again, you got to choose your battles wisely. I mean, am I going to die on this hill? Am I going to die on this hill? You got to think about that too. But I think if you keep going back and say, I know, but I think if you go, our data does not show that she has that need. And then until we can identify that need and take some data, or you provide me with some data that says she really needs it, we need to put this plan in to help her have access to and participation in gen ed. I mean, I think if you just keep repeating yourself, I've been in some great 504s where they toed the line. Those counselors like, we just don't have the data to back that up. Mr. Smith here said he does da-da-da-da, and Ms. Jones did this, and boy, we just are not seeing that behavior at all. And he's accessing the curriculum just fine. And we have to write this plan for accessing our curriculum in school setting. I'm sorry that those things are happening at home. I didn't say that. But you know what I'm saying? It was like, this is about access and participation in the school setting. And keep it focused on that. Yes?
I have 2 quick questions about accommodations. First one is, can we I'm looking at, for example, accordion folder or graphic organizers. Can we, put in an accommodation that family will provide?
Yes, thank you. Thank you for bringing that up, because I've seen that and I do put that in. One of the things we talked about is when a parent says, oh, he's got a cell phone, like I've seen this is really great. Organizational tools. Kid's going to take pictures of the assignments. They're not having an assignment because he'd lose that planner anyway. But he's going to go up and he's going to take pictures with his cell phone of the assignments for the board. And that's how he's going to keep track of them. He's going to put a little like assignment reminders in his calendar. I think it's a great tool. Use it. But make sure you put student-owned personal cell phone so we're not paying for that. Or my kid's got a laptop, or my kid's got a Chromebook, or he's got an iPad, or he's got student-owned personal, okay? In this one, the teacher offered an accordion folder. She's like, I've got one, this is great. I have headphones. I was in a 504 just last week, and at Cimarron. And she was, I have some noise canceling headphones that I will just label just for you, and you can use them. They're in my drawer. You can pick them up anytime you want. Okay? So that was fine, because the parents like, I don't have those. I got it. No problem. Okay? But for those big items, definitely personal, for sure.
And then my other question is, before when we were doing this training in years past, we were told that we cannot put in accommodations that are assessed that any student in the general can also have access to. I'm trying to think of an example. Maybe for maybe preferential student, maybe meeting with school counselors to go over organizational stuff. If that's available to all students, we can put that in. You know what I mean? Like, is that true, and where's the line with that?
I think that when you're talking about those things, if that's what the student needs, I would structure it differently.
So just phrase
Yeah.
it in a way that... Okay.
That if it's tied back to the need and evaluation that they need it, and that's the accommodation you're going to give, then I would structure it that way.
Okay.
But again, make sure you're picking an accommodation that addresses the need. Maybe there might be an easier or better way that you can access that in the classroom. We always want the least restrictive environment, so we try not to do all the counselors and psychologists and mental health people pulling those kids in to do these things. We want it to happen in the natural environment of this classroom. That's the biggest piece. Okay? Did this help seeing the example? Because you're the first ones that I'm doing this with.
Yeah.
Okay, it did? Okay. Yes?
The age-old question of accommodations and then modifications, like if a student, well, I guess if you're expecting the student to, like all the other students are learning 10 of the standards in a quarter for science, but the student has a sleep disorder and misses so much school because of it, and we're only requiring to learn these 5 extremely important ones is that modifying the curriculum?
Modifications come when the expectation of the what changes. So if you are taking away content that person needs to learn, then that's a modification. And if you're modifying for that extremity, then why aren't you considering special education? I would really look at accommodations is if Nancy has to do 50 and they're 50 of the same content, same master, same issue, and Annika, I only give her 25, but yet I'm still going to get demonstration of that skill. She just has to do less of them, then that's an accommodation. But if I'm changing, she has to do 50 of this and about that, and she's doing 25 of this about that, then it's a modification. I have now changed what she learns. It's changing the how is an accommodation, and the what is a modification. The only modifications that I have seen legally under the 504 is just really physical modifications to different things like materials or other pieces like that to accommodate for the 504. Like especially physical environments, ramps, large print, table, chairs, different things like that's those physical modifications. And modifications in the realm, especially when it comes to PE content for kids with physical disabilities. You might look at those that they would do alternative assignments or other modifications to that because of their access, because of their physical disability. So it depends on that level. Does that make sense? So really quick, and then we're going to take a break because we're a little past where we need to be. But I love all the questions. I think this is a great dialogue, so thank you. So presentation accommodations, it basically is how we present the information to a kid. So when we're looking about presentation accommodation, that's what we mean. One of the things that I saw on a 504 was a parent wanted Learning Ally, which is $120 per kid. And it's is audiobooks library. We have lots of resources. We have DLMC, we have our public libraries, kids can download them from iTunes or Google Play, so much cheaper than paying for those things. So again, if parents demanding Learning Ally, okay, what need is that addressing? Well, they need books on CD. Okay, well, we can address it in this way. Okay, so be careful. You saw in the example, it said use of dictation software. I didn't say drag and dictate. Because she might use drag and dictate, but the kid moves to this school and they might use something else. But I put in the accommodation of the dictation software because software is software. I'm not naming anything. So be careful not to put names of things in there, okay? And then we have response accommodations. Obviously, how the student's going to respond, oral response, scribe. If you say use of a computer, like you said, personal computer, student-owned, whatever it is. Make sure to be very general about that. Or if it is their own, make sure you specify that. Setting accommodations where they're going to be going to take tests or quiet areas. I try to use headphones, noise-canceling headphones or headphones to try and eliminate the distractions. I just turn a student within their gen ed classroom, turn them to a different spot, and plug them in to like limit distractions. The more restrictive is putting them in another room. So try to do what you can in the classroom, but if you have to go to a separate room, you can do that. And timing accommodations, extended time, just be specific. Specificity is the key. We talked about that. Just remember that if we are going for state assessments or even ACT assessments, I always tell people, especially in high school, we have to show a pattern. It's so much harder nowadays to get ACT accommodations for extended time. A lot of parents come in high school and want a 504, so they get extended time on the ACT. We see it over and over and over again, right, Michael? Lots of ACT accommodations. So I always say it's really difficult. You have to show this pattern of this issue and this problem for a long time. When we have to fill out that special request, we have to show a pattern. So, and we have to show that they're using it. We document it in IC, okay? So we looked at the non-example and the example, so it's there for you to refer back to if you need to. Healthcare plan, I want you to tell the difference between a healthcare plan and a 504. A healthcare plan talks about reactive services, and a 504 is preventative. Peanut allergy. How many peanut allergies we have? I'm not saying every kid with a peanut allergy is going to qualify for a 504, but if they have a peanut allergy that is life-threatening and it limits access to participation in, okay? A peanut allergy, a healthcare plan is probably going to address all of the reactive things. When the kid has been exposed to this is what we do. Down to one, we do da-da-da-da-da, okay? That's what's listed in a healthcare plan. A 504 will say, we're going to make sure that they have all these things in place to prevent them from this piece. These are all the things we're going to do. We're going to train people. We're going to make sure they know. We're going to post signs. We're going to send letters, whatever you're going to do. Okay? That's the preventative 504 accommodation so that we can prevent exposure for a peanut allergy. And that's the difference.
So for that, I have a quick question. With concussions in particular, because you see health plans a lot of times with concussions.
Right, thank you.
And so I guess what I've kind of discussed with my school nurse is that the difference with regard to concussions is if you go to a 504 eligibility process, when it's showing that the concussion is still significantly or substantially impacting them.
Yes.
You know, it's not something they just getting concussion, you don't put them on a 504
Correct.
plan. It has to show.
Right. So say, for example, a kid breaks their leg. I knew schools that were writing 504 plans for kids that break their leg or had surgery on their ankle or something like that. If an impairment goes for more, that's a temporary impairment. If it goes for more than 6 months or more severity beyond that, then they're not going to qualify, or less than 6 months, excuse me, then they're not going to be looking at a 504 plan. And even if it goes beyond 6 months, it could, but it doesn't rise to the level that it's severity, it's physical impairment, and it's impacting, then it could not be a 504. So concussions are in that gray area because there are some kids that get their first concussion and it takes them about 4 weeks to get back into the string. But sometimes they have a first or second. Every kid, every person responds to a concussion very differently. And that's why we got to rely on our health professionals to do that. But if it's a second concussion and you're going longer than that time period and you've got documentation from the doctor that says, yeah, this second concussion caused some traumatic brain injury and they're not going to get some of these memory skills back, or we've got documentation. That's why you always want to, and you can get a release of confidential information. You can ask your nurse or to get release of information so we can drill down to that, back to the doctor and ask those questions. How significant is this TBI? Is this really enough that we would warrant a 504, or do you think they're going to rebound back within 6 months?
So is that 6 months in writing?
Mm-hmm.
It is, okay, because
It's
I
in the
know
law.
parents really fight this.
It's in the law somewhere. I'll drill it down and give you the link.
So
It is. And then I guess the other thing is that what I would say, and thinking of Jason's ideas in mind, if a student has a concussion, then we definitely can extend accommodations for them. Definitely, without having to do a 504. I mean, if a kid comes back, you've got your own trainers that say, all right, guys, and they kind of put a healthcare plan or assessment or whatever, say, hey, give them some time to process. Give them time to get extended. Don't put so much undue pressure on them for assessment and other stuff. We still need to follow through that. We don't have to do a 504, but we should still be accommodating that kid with that concussion, for sure. It just won't be formal in a 504.
I just was gonna say, so with diabetes, 4 years ago, that was like every kid with diabetes should have a 504. That was the edict.
Right. Yes, I heard that. Yes. Amazing. And so I just talked to Paulette right before this, and Paulette's got a, and I'm gonna put it up on the 504 link too, is that she's got a lot of great guidance and like things that should be going in a 504 if a kid has diabetes and that it rises to level of a 504. So I will put that on the website. I'm hearing a lot, and I saw a lot of cases that diabetes is almost like an automatic, almost. I mean, I haven't found many cases that have said no, but it depends on the extreme case. I mean, like, how that's impacting their accessibility to education.
Well, I'll tell you why. It's for ACT testing, because they get their own room for national testing. Because I'm a national testing coordinator, and I have kids all the time that are given their own room, so that if they have whatever, then they can have their snacks and whatever. That's what it's for. Gotcha. But it's not. I don't think it's preventative. It is actually all the things.
It's more healthcare plan. I know.
It looks exactly like.
Okay, but she's got guidance on all those preventative pieces that should go in the 504. Okay, we're at the level to do an interim assessment. This is a great time for us to take a break. Bathrooms are straight through there. I've got water here, cookies, some snacks and stuff like that. Hopefully you'll do 90 or bev on the interim. Hopefully. And then we'll review the interim together to make sure that you did. Yeah. Michael, question? Did you have a question?
I did. It was the broken leg thing.
Yeah.
Because transportation tells us if the family, like we had a kid in an accident.
Almost 6:30.
And it's had major surgery and stuff, and so we they requested their offer.
Yes,
like
it is. I did do it in the formative, but it was
okay. That could be going through Donna.
But they called they're just
what she's
homeless
being
now,
funny
but they've
about.
always like struggled and they couldn't get him to school, so they requested transportation, and transportation is telling us they have to have a 504 plan in order for them to provide special transportation.
No, but I would put that back on. What's her last name? Jackson? Is it Donna Jackson? Searcy. I always forget. Okay, yeah, Searcy. I would go through her about that piece.
Well, he's
Other than
fine
that,
now, but it was
I know.
we put a 504 plan in place so that he could get special
Yeah.
transportation. Because that's what they
Wow.
were saying.
Okay. All right, so interim assessment, and then we've got some cases to look through. Yahoo! And then we're gonna take. No, we're gonna legal cases. What got districts in trouble? Not ours, not our district, other districts.